Appendicitis is a medical emergency that happens when your appendix becomes sore, swollen, and diseased. The appendix is a thin tube that is joined to the large intestine and it sits in the lower part of your abdomen. The appendix also works as part of your immune system and also helps the body to fight diseases. So the appendix can get infected and inflamed, and if not treated, it can burst or rupture. So this is serious and can lead to more infection and death. So what causes appendicitis? Appendicitis always happens when the inside of the appendix gets blocked by something. So this makes it well up and that makes the blockage worse. The bacteria that live inside your intestines are the ones that start up the infection. If you have appendicitis, there is a serious risk that your appendix may burst. So this can happen as soon as 48 to 72 hours after you start having symptoms. So because of this, appendicitis is a medical emergency. So if you have any symptoms, you should see your health care provider right away. So when the appendix becomes sore and swollen, the blood supply to the appendix stops as the swelling and soreness get worse. You should remember that all the organs in your body need the right amount of blood to stay healthy. So without enough blood flow, the appendix starts to die and it bursts because its walls start getting holes. So these holes let stool, mucus, bacteria and other things leak through and get inside your belly. So this leads to peritonitis. Peritonitis is a serious infection throughout the belly that happens when the appendix or any other part of the intestine or stomach has a hole and leaks out its contents. So who is at a risk of appendicitis? Appendicitis is the most common cause of sudden belly pain that requires surgery. So it mostly happens in teens and young adults in their 20s, but it can happen at any age. Also, having a family history of appendicitis may raise your risk, especially if you are a male. What are the symptoms of appendicitis? Symptoms of appendicitis vary, but today we are going to talk about the most common symptoms. Number one, pain in the abdomen. So this is the most common symptom. So this pain may start around your belly button area and move to the lower right hand side of your belly. Or it may start in the right hand side of your belly. So this pain might also get worse as time goes on. So you may feel worse when moving, taking deep breaths, being touched, and also after coughing or sneezing. So this pain may also be felt over your belly when your appendix bursts. Other symptoms may include number one, stomach upset and vomiting. So this comes after digestive irritation, blocked intestines, and toxin release. Number two, loss of appetite. So this comes due to inflammation of the appendix, which triggers pain and a slowed digestive system. Number three, fevers and chills. So fevers and chills in the appendix occur due to the body's immune system to infection and inflammation. Number four, constipation. So this occurs due to inflammation and reduced intestinal